Good afternoon. My name is Steve Hughes. I'm here with OrthoVirginia and very proud to get to do the Facebook Live this afternoon. As everyone knows, we've got 14 locations here in Northern Virginia, and I wanted to say what an exciting time this is for us in the spine division. We've got new pain management group headed by Dr. Cherik and Dr. Ye Sundar, with new spine surgeons with Dr. Wegner, excellent trained with Dr. Young, Dr. Mazahari, myself, Dr. Child. So it's really an exciting time to be up here, and I'm really thrilled this afternoon to get to talk to you all about something that we see all the time in the clinic, and that is what are some of the reasons we need to be seen for back and neck pain? It's a very important topic, and there's a lot to unpack here. So we're going to take some time to go through it and then answer your questions, hopefully. So what I'd like to start with is what are some absolute red flags that you all need to know about out there? These are things that, hey, doctor, I came in because of X, Y, or Z, and I really need to be seen. Because pretty frequently we'll see in the clinic patients that have got a day or two of back pain, or they had back pain and it's already gone. And so these are the things that as physicians, it's kind of a red flag list. These are things that you really need to get in and see a doctor about. And as I mentioned, we've got an excellent pain management service here. We've got an association with the United Health Group, with the chiropractic group, and just there's lots of providers that can get you help with these things. So let's start to review some of these now. First, and it's pretty obvious, if you've had recent serious trauma, soccer injuries, football contact injuries, motor vehicle accidents, of course, serious trauma is a good reason to get in to be seen. And as we segue into the next thing on the list, older age, even fairly insignificant trauma, if you're over the age of 70, should probably be seen, because stress fractures, osteoporosis fractures, and other things can happen in that age group. So anyone that's in the older age categories, anyone that's had serious trauma, you really need to get in and be seen and get some x-rays and get evaluated. This is a pretty frequent one. The next on the list is urinary or bowel incontinence. These two things are also frequently misunderstood. Someone will say, well, I had some pain and had a hard time getting to the toilet once, but now it's better, or some bowel issues, constipation, or some diarrhea. It's very rarely associated with back problems, and it's not a coming and going type of a symptoms. If you've got symptoms of urinary or bowel incontinence and they're just staying with you, you need to get into an emergency room and be seen quickly. It's not a on and off type symptom. It's a continuous symptom. Do you have a history of malignancy? Colorectal cancer, breast cancers, etc. Are you not trying to lose weight and seeing 5, 10, 15 pounds of weight loss? Another reason, when it's associated with back pain, that this is a red flag to get in to see your doctor. Asthmatics and others, rheumatoid arthritis, etc., that use steroids, prednisone, on a regular basis. These steroid use weakens the bone, and as such, back pain is much more important in that group. So if you are a chronic steroid user, it's another reason, if you're having back pain, to take it serious, get in and see the doctor. Everyone knows what sciatica is. It's the old term for pain in the lower part of your back, into your buttocks and down your legs. And that sciatica, particularly when it's associated down both the back of both legs, that is a red flag. It means that you should get in and be seeing somebody soon. And typically, if you can't see anybody within a day or two, it really is reason enough to even go to an emergency room. So most of this talk is going to be about these red flags. And again, bilateral sciatica is a pretty significant one. One of the great things we have up here in Northern Virginia is the urgent orthopedic clinics, which are fully staffed and manned and run really great, in addition to our 14 regular clinics. So there's really pretty much instantaneous access when you get ready to see a doctor. So moving on, if you've had any kind of a severe bacterial infections, not viral infections so much, but pneumonias, intestinal bacterial infections, they can seed in the back or the neck, and that can cause severe back pain. And as such, that's a very good reason to be seen also. And lastly, if you're a user of injection drugs of any kind, back pain in association with injectable drug usage is a real red flag, needs to be taken serious and needs to be seen. So we got our red flag list out of the way. Hopefully you guys can screenshot that or in some other way, take it down, because these are reasons, these red flags, to get in and see one of our excellent mid-level providers or physicians at your earliest convenience. That being said, I'm going to spend a lot of the rest of the talk about things like what's acute versus chronic back pain, because as you guys all know out there, 4 out of every 5 people during their lifetime are going to have a significant back pain flare, and some unlucky people get it even more frequently. So now we have to determine, once we know what our red flag list is, let's talk a little bit about what's acute versus chronic back pain in the context of those red flags. Acute back pain is that back pain which starts and is typically gone within a couple weeks. Now, it's very common for me to see somebody that will come in, and back pain can be very severe, back or neck pain. They'll come in and I'll see them about a week to 10 days after the episode, and it's gone. So acute back pain usually can be taken care of by simple over-the-counter analgesics, and start exercising. Do not lay around in bed. Get up and walk, move. And acute back pain, as long as you don't have these red flags that we talked about earlier, acute back pain is typically going to sort itself out quickly and will be gone within a week or two. So, and when I say gone, I mean diminishing. So even if you've got acute back pain and it's, say, 50% better or 25% better the next day, this is a good kind of back pain to have, because all you got to do is get up and move, an occasional heating pad, a little over-the-counter medications, and this back pain almost certainly is going to be gone. You do not have to waste your time in the doctor's office. So it doesn't have to be gone. It just has to be significantly decreasing every day. Chronic back pain, on the other hand, is a little different story, in the sense that this is back pain that goes on over a month typically, is getting worse, not better. And that type of back pain, when you get past a month to 6 weeks, it's not unreasonable to check in with one of our staff about what could be the causes of that. I would say particularly the younger you are, and as the back pain goes past a month, 5 weeks, 6 weeks, the more important it is for a 15 or 16-year-old to be in to be seen. And of course, all very young children with back pain should be seen pretty quickly. But that's the definition. Acute is typically back pain within a couple weeks. Chronic is pain that lasts a month or later. A very common question is, do I need some x-rays? X-rays are very much overrated, particularly if you don't have the red flag signs and say you're in the office and your pain is already starting to diminish, you do not need x-rays. And x-rays do not need to be repeated on every visit. It certainly is radiation. It's not a lot of radiation. Nevertheless, it's just unless you've had a surgery, unless your doctor specifically is asking for the x-rays, In general, we don't need to keep repeating x-rays. The x-ray changes that we're looking for, they don't rapidly evolve. So I would say always ask the question, do I really need this x-ray if you're in the doctor's office? The other thing I hear a lot is, well, I've come in with my back pain. Do I need an MRI? The doctors told me that I don't need x-rays too much, but gosh, I've had this pain now for 6 to 8 weeks. Do I need an MRI instead? And the answer to that question is it is a very expensive test. It is a test that I say typically should only be ordered by mid-levels or like PAs, nurse practitioners, or your doctor. And that's only after reviewing x-rays and after you've made the determination that this more advanced, expensive imaging is necessary. There is an epidemic of overprescription of MRIs, and the MRIs actually show us almost too much because we will talk about the MRI report a little bit later, and it's one of the central themes in today's talk. We're going to go over in a lot of detail. MRIs show us too much, and you see abnormalities on the MRI that may not necessarily have anything to do with why you're having pain. And as such, we need to be cautious and ordering MRIs only when necessary. We've got a great physical therapy department up here. The physical therapists and PT aides, just can't say enough about how great of a job they do helping patients get active, be active throughout a back pain episode. And they also will counsel when they feel like you should be getting an MRI as well. We've got great communication with them. They send us a text or email, and the system works very well. But in general, you don't need x-rays a lot. You need MRIs even more infrequently because of it's just a huge burden on the health system to have this kind of continuous expense. So that being said, you're in the doctor's office. They have done x-rays, they've done a physical exam and determined that you do need further treatment, that just exercise and activity or home exercise is not going to work. Usually our excellent physical therapy team will get involved in helping you push through the pain and strengthen your core. But medications have been in the news with this. And what has been proven over and over again over the last 10 years in numerous studies is that narcotics are not needed. So you don't have the impression that Percocet or Norco or Dilaudid is going to be prescribed, because all of the physicians, everybody's mid-levels, everybody's getting away from using that medication because they're only for very rare circumstances of back pain. The medications that we typically are going to use, if anything, is going to be over-the-counter anti-inflammatories, Tylenol, and some simple occasional muscle relaxers. And really what they're best for is people with acute muscle strain type back pain that are having a hard time sleeping. So for 2 or 3 days during that time frame, it helps you get some sleep. One of the things that you're going to be in charge of, because you can't spend all day with the doctor, usually they're going to be just a short time with them or your mid-levels. So you're going to want to know where to go. I think the internet is one of the greatest things that's happened to spine care, because it is good to go talk to Dr. Google, Dr. Chat GPT about your back pain. As long as you've consulted with a specialist with this, I find these two websites, spinehealth.org and medscape.com, to be two really excellent sources of information about back and neck pain. And I think when you use them in conjunction with your visit or your telemedicine visits, with a provider, I think you can really learn a lot, and it really prompts you to write questions down and to, think of more things that you can get out of the visit ahead of time or afterwards. So Now that you're in my chart and you're reading through your MRI report or your X-ray report that the doctor has done with you, and you've seen the words spondylolisthesis, spondylolysis, spinal stenosis, bulging discs, et cetera, et cetera, et cetera. Very scary stuff to read, big, long words. You can spend all day just looking them up. One of the things to really realize that I think you're going to see this change over the next 5 to 10 years is doctors and everybody really that's in the medical system has got to be more careful about the words they use. And spondylolisthesis, spinal stenosis, et cetera, could also just be called standard degenerative changes of your back. And I think it certainly makes you feel a lot more comfortable realizing that these big words that you're reading just means that, hey, my spine is aging. My doctors told me it's aging kind of on par with what would be expected. The reason that's important is if you see that your back is aging and not aging out of bounds, but just aging regularly, you feel more comfortable staying active, doing your exercises, doing your sporting activities, because these are not diseases or illnesses. This is just a simple matter of the spine gradually getting older. And I just really want to emphasize that it is good to learn these words, but it's good to realize that most of the words are going to mean simply that your spine is aging. And your doctor, of course, will explain more about that to you. Another thing I get quite a bit with this is, hey, do I need stem cells or PRP? There is really no literature currently that is peer-reviewed, blinded, or anything else that shows that these very expensive, typically non-covered regenerative medicine injections, stem cells, Wharton jellies, etc., have any effect on the back. So I want you guys to really, as you walk through the medical system, be very skeptical and ask over and over and read about what the FDA has said about this and what is the truth about the fact that we currently do not, for spine programs in particular, this is not a standard or well studied phenomenon of do these techniques work. So I want you to really be skeptical and question that. And then sort of the last overview about, when is it that I'm going to need surgery for my back pain? And the answer is almost never. Spine surgery in the 26 years I've been doing it is just one of the safest, most effective procedures you can get. It works, it changes people's lives, and you can see it, based on the testimonials. Just get on the internet and sort of look at what the patients have to say about this. Nevertheless, out of a 200, patient week, 1 or 2 of them, or maybe 3 will need surgery. It is just very, very rare to have to need surgery for your back. As such, the answer to this question is, when do I need surgery? Basically, almost never. And that's a discussion that's going to take a lot of time with your provider. And as you walk through that with them, make sure you get the specifics on, why do I need surgery? What is the goal of the surgery? And really walk me through the technique of what you're going to do here. So again, I really appreciate you giving me this short period of time to talk about some things that are near and dear to my heart. I cannot say how proud I am of our spine team all through OrthoVirginia, but I know everybody here up in the north the most. So thank you again for letting me speak to you today.
Thank you so much, Dr. Hughes. We do have some questions. So the first one is, are back muscle spasms a red flag?
No. In general, muscle spasms in the back is probably the most common reason. Out of the 4 out of 5 people that get back pain, most of them are going to be muscle spasms, and they resolve very quickly. That's why you make the doctor appointment. It takes 10 days to get into the doctor, and you're basically walking into the doctor feeling normal. That's a muscle spasm or strain that you've done, and there are hundreds of muscles in the back, and it's easy to strain them. And so acute muscle spasms It's one of the most common reasons for doctor's visits, and most of the time it's gone by the time you get to the appointment.
Thank you. So going back to the MRI report, someone says that there were some words that they didn't recognize when they were looking at their MRI report, and they tried to look them up. They got a little confused. So should they send a message to their doctor via MyChart? Should they make an appointment? What should they do?
I think the main thing is of course, it never hurts to look, online, and particularly with those two, I want to say them again, spinehealth.org and medscape.com, to look at those websites and look up some of this. But the biggest thing is don't be alarmed, because the words, sound scary. And then when you look at the pictures too, I mean, you can see some pretty dramatic amounts of stenosis, and people are doing great. I mean, they're walking around doing all the activities they want to do. Human bodies are incredibly tough, incredibly resilient, made with a lot of ability to overcome issues. So what sounds bad on an MRI report, 3-paragraph MRI report about just a 60-year-old spine, I just want to emphasize that does not mean that you've got any kind of a dangerous condition.
Thank you. How does radiation for cancer affect back pain?
Radiation for cancer is the most commonly used technique initially for people with metastatic disease, cancer that's gone to the spine. And it's a excellent technique to diminish people's pain and neurologic deficits when they're suffering from cancer of the spine. So it's been used for decades now. It works great, but again, it's for a very, very sub-select group of patients.
Thank you. How can you determine what is a spine issue and what is a muscle issue?
Typically, it's by the rapidity of how much it improves. Muscular or spine issues can be very severe pain. And for example, a compression fracture causes muscle spasms. So the two are, they can be linked pretty closely. But muscle spasm is going to let up very quickly. Within 24 to 48 hours, people are already going to be starting to see rapid improvements, in what their symptoms are, as opposed to somebody with a fracture. The pain will actually be increasing. I mentioned fractures again, and that's only for our group out there that's over the age of 60 years old, because again, osteoporosis and compression fractures can happen with relatively trivial episodes. So fractures cause muscle spasm, and that pain tends to increase, not decrease.
Thank you. So you talked a little bit about stem cells and PRP, and I know a lot of the other OrthoVirginia doctors use those. So can you just clarify what the difference is that you're talking about?
Yes, and I mentioned that earlier. I want to make sure I emphasize that this is not in relationship to sports injuries or a non-operative sports group, because there's a lot of literature out there as to how PRP stem cells can help and get people back to vigorous activities quickly. And thank you for bringing that up again, because I mentioned it, but I want to mention it again. The sports world and the tendon, ligament, muscle world is absolutely, has got the literature to support stem cell PRP usage, and our group of doctors does it very, very well. When it comes to the spine, however, it's a little different ballgame, because there's not the literature out there. There just is not much known about it. And indeed, quote unquote, stem cells like Wharton's jelly and other unusual stem cells, there was a warning put out by the FDA that those really should not be used, and it's dangerous for the spine to be doing that. So I want to really separate out my sports colleagues from us, from the spine service, because that is an absolute difference.
Thank you. Is acupuncture helpful with spine pain?
I don't know much about it, but I certainly do know that if you've got pain that's gone on for over a couple of weeks, and if you're in a situation where the physical therapy is not helping, and they do a technique, by the way, called dry needling. So I would ask you to make sure you talk with your therapist about that as well. They're very good at that here. Acupuncture could be considered. I've had patients say it works. I just don't know a lot about it.
Thank you. We have somebody who's over 80 who has back pain when they wake up, but it disappears during the day. Should they be concerned?
Definitely, because of the age, it warrants an evaluation, but I certainly wouldn't be concerned. Morning pain, when somebody's been relatively immobile and in a horizontal position throughout the evening, the body fluids settle and tissues swell and nerves get pinched and muscles become boggy. So when we wake up first thing in the morning, there can be a lot of pain. And morning stiffness and pain is a hallmark of degenerative osteoarthritis, something that all of us, unfortunately have to deal with. So I would tell our 80-year-old to, certainly get an evaluation, but I certainly wouldn't worry. I doubt it's anything serious.
Thank you. Should someone be concerned with the constant cracking in their lower back near their hips while they're exercising?
No, I hear about that all the time. And cracking of joints is simply, gas bubbles, nitrogen bubbles popping as the joint gets stressed or moved in an unusual way. And back popping, neck popping in particular is something that gets more frequent as we get older, together with the grinding episodes or sensations of gravel in the neck or in the back. And those are not things that people need to worry about at all.
Thank you. Can sciatic pain be fixed with surgery?
Absolutely. As I said earlier, in the small percentage of people that get surgery, and we, as a spine surgeon, we do a lot of those. It is one of the safest, most effective surgical procedures when done for the right indications and done for the right goals. It is one of the safest, most effective surgeries mankind has developed. So yes, it works.
All right. Thank you all so much. That is all the time that we have for today. If you asked a question during the live event, we will answer it later in the comment section. Dr. Hughes, would you like to close?
I would just like to say thank you all for attending today's live stream visit. I'd like to thank the group that put it together, and I'd like to just say again, OrthoVirginia's spine service is growing. It's great, and we're waiting for you.